Welcome to Lilly Beauty Mantra. Menstrual cramps. 5 tips to get relief from period pains. That time of the month is always inconvenient and never fun. Adjustments to your bathroom routine aside, there are several other annoying symptoms of periods. Food craving, sleep disturbance, bloating, mood changes, usually irritability, fatigue, tender breast, and more, most of which start before your cycle even hits, serving as ominous signs of what's soon to come. And then there are the cramps. If you are one of 8 women who experience period cramps during your menstrual cycle, your time of the month is probably the worst time of the month, right? So, fortunately, we have some doctors, gynecologists, and housing methodologists in here to explain why we even get menstruation cramps and help you find some period pain relief. So these are some tips that they have shared. What causes menstruation cramps? To understand why period cramps happen, it helps to take the step back and consider why we ever have a period in the first place. As a part of the normal reproduction cycle, a woman's body prepares for pregnancy. Perhaps the most well-known part of this process is menstruation, also called as period, which is when the uterus shed its lining. Explained by doctors. This purpose of is to help prepare the uterus for receiving and nourishing a fertilized egg. With this shedding comes the release of blood and tissue from inside the uterus. But periods also come with symptoms, ranging from annoying to painful, including cramps. In order to shed its lining, the muscle and blood vessels in the uterus contract. These contractions can cause cramping in the lower abdomen and back, says doctors. Period cramping can feel differently for different women. Some have only mild discomfort while others experience severe pain that can make everyday tasks very difficult. After menstruation, which lasts anywhere from 3 to 7 days, your uterine lining regrow and thicken as more time passes ovulation occurs. If no fertilized egg is present after ovulation, it is a signal to your body that it's time to start the menstrual cycle over again, adds doctor. And the cycle continues. How to relieve period cramps faster at home? Here are 5 ways to help you relieve from menstrual cramps. First, apply heat. Heat can help relax the muscles, contributing to cramping. So, applying heat to your abdomen or back can help relieve your pain. Using a heating pad or soaking in a warm bath are great ways to ease period pain, but you can also use heating patches if you're looking for a discreet on the go way to get relief. Second, take a pain reliever. Since period cramps are painful, it's probably fairly obvious that pain relievers make the list of the remedies. But when it comes to period cramps, are all pain reliever options created equal? Different classes of pain relievers work differently. For period pain, NSAID non-steroid anti-inflammatory drugs are likely to work best since they can reduce prostaglandins, the hormone that stimulates the contraction leading to menstrual cramps, explained by doctors. Ibuprofen and naproxen are examples of NSAIDs. Just to be sure to take each of these medication according to the label's instructions. Acetaminophen may also help dull your pain, but it doesn't actually address any of the inflammation that might be contributing to the severity of your period cramps. And while some medication claims to specifically relieve period pain, such as Midol, just to be sure to check the label as may, are multi-symptom medication that contain several active ingredients, but don't always contains an NSAID. Third point, exercise when you're in pain. You may think it's best to relax and get some rest, but physically activity is actually a natural pain reliever. Exercise stimulates the release of endorphins, which are chemical produced by the body that help block the prescription of the pain, says doctors. Plus, exercise is also a great way to reduce stress, which also happens to affect how you feel the pain. Fourth, take steps to reduce stress. Stress affects your body in many ways, including lowering your threshold for pain, says doctors. Reducing stress in easier said than done, of course, by taking steps to do so can help you find relief from period cramps. In addition to exercise, here are the several ways to reduce stress. Yoga, deep breathing exercises, meditation, counseling. Fifth is get your vitamin and mineral. Eating a healthy diet may be yet another way to relieve periods pain, since certain vitamins and minerals have been suggested to help reduce cramps. More research is needed, but some evidence shows that vitamin B1, also called thiamine, and magnesium may help reduce period cramps. These are two vitamins and minerals that most adults typically get plenty of through a healthy diet, says doctors. Foods rich in vitamin B1 and magnesium includes nuts and seeds, whole grain legumes including beans, lentils and chickpeas, spinach, cauliflower, kale, avocado, asparagus, oranges. What to do when menstrual cramps are severe? The period cramp relief tip above are good place to start, but when may not work for every woman, especially for those who have very painful cramps. If you are experiencing serious pain during your periods, it's important to talk to your OB-GYN. She or he will ask you about your symptoms and cycle and can recommend lifestyle change that may help ease your pain, as well as perform a pelvic exam and prescribe medication if needed. For instance, hormonal birth control medication are sometimes used to treat menstrual cramps and the pain that accompanies a period, says doctors. Plus, in some cases, severe pain may be sign of something more serious. Beyond the significant impact that the period pain can have on your everyday life, the cramp themselves aren't typically a medical concern, says doctors. However, severe menstrual cramp can sometimes be caused by more serious gynecologic conditions. In certain cases, severe period cramps can be a sign of endometriosis. Uterine tissue get implanted if your fallopian tube, ovaries, or pelvic lining uterine fibrous, non-cancerous uterine growth that can cause pain. Adenomyosis, your uterus tissue grows into the muscular wall of the uterus, pelvic inflammatory diseases, infection of uterus, fallopian tubes, and or ovaries. A few of these conditions can affect fertility and impact your chances of having a successful pregnancy, which is why it's so important to be evaluated by an gyno if you are experiencing serious pain. Thank you.